Welcome to the Cereneuro Journal Club, where we explore the latest and emerging scientific evidence in neurorehabilitation. Our mission is to bridge the gap between the lab and clinical practice, empowering therapists and patients with knowledge that can truly improve lives.
So I'm going to talk about, I'll mostly talk about the paper. So our study looking at using digital cognitive behavioral therapy for insomnia in community dwelling stroke survivors. But this is really kind of a part of a longer journey. So I'm also going to talk a little bit about some of the things we did that led up to the paper, and then some of the things that we're doing now that it's been a couple of years since we published it. So I guess the first thing to say is that this is, as I'm sure you are very well aware, a massive team effort. And many of the people in these photos have been involved along the way in various aspects, so can't do it without them. So first of all, just to sort of highlight, as you probably are already aware, but that sleep disruption or sleep disturbance is really common in people who have had a stroke or brain injuries of other types. And this is not just the case when people are in the hospital environment, which obviously has its own disruptions, but is also something that persists many years after people have that initial injury and are back living in their homes. And we started with a couple of sort of observational studies where we wanted to better understand sleep changes in stroke and brain injury, and sort of start to explore how this might be relating or impacting on recovery outcomes. So we did two studies, one in people who were in the rehab hospital, which was a mixture of brain injuries because it was a mixed neurological rehab unit. So many people did have a stroke, but some had a traumatic brain injury or a hypoxic brain injury. And we also tested people who had had a stroke and had been discharged from hospital, so back living in the community. And what we did is use a questionnaire that's called the Sleep Condition Indicator. It's a questionnaire that is designed to look at symptoms of insomnia, and this is something that we were particularly interested in. It aligns with sort of DSM criteria for insomnia, and it's a relatively straightforward questionnaire for people to fill in. It asks about difficulties initiating sleep, difficulties maintaining sleep, and the sort of knock-on effects that has to people during the day. And so this we found was a particularly useful questionnaire for people who had a stroke or a brain injury because it was relatively quick and easy for them to be able to answer the questions. And so this questionnaire is scored out of 32, and the lower the score, the more symptoms of insomnia the person has. So the graph on the left we have is our patients in the rehab hospital. The graph on the right is our stroke survivors living in the community. And we had a cohort of age and sex matched healthy controls who were living in the community. And for both the people in the hospital and the people out of hospital, we found that there was significantly poorer self-reported sleep on this questionnaire for people who had a stroke or a brain injury compared to people who didn't. And alongside that, we also were interested in sort of what proportion of people would have a likely insomnia diagnosis. So this questionnaire has a sort of cutoff that you can use, and people below that cutoff have a probability that they have insomnia disorder. And we found around about a third of people sort of met that threshold at the time, compared to about 11% for the control group, which is sort of about on par with the general population. Since we did the study, which was many years ago, there's actually been some work that's come out that has suggested that a slightly lower cutoff is probably more appropriate for people who have had a stroke. So that probably brings that proportion down a little bit, but it's still quite a high proportion of people have probable insomnia after a stroke or a brain injury. And so the other thing that we were interested in is how sort of self-reported feelings about sleep might be mirrored by more objective measures of sleep disruption. And we chose to use actigraphy. I'm not sure if that's something you guys use in your centre, but it's a really sort of useful proxy for how disrupted people's sleep are, on the basis of how much people move around. So it's basically an accelerometer, you pop it on the wrist and they can wear it for weeks at a time, and we can get some good understanding of how disrupted people's sleep is. And what we found, again, for both our people in the hospital and the people out of hospital, is that there was significantly more disrupted sleep for people with brain injury in comparison with people who didn't have a brain injury. So this is a measure called wake after sleep onset, which is sort of an estimate of how much time people are spending awake during the night after they initially manage to fall asleep. We have other measures of sleep disruption which also show the same sorts of patterns. So this really sort of tells us that not only do people experience poorer sleep, but there's some indication that their sleep is in fact more disrupted at night. And unfortunately, what we also have is growing evidence that this doesn't really seem to get a lot better with recovery. So on the left there, we have the people who are in the hospital again. And because they were in the rehab unit for quite a while, we were able to assess them at multiple time points throughout their rehab journey. And again, we've got the sleep condition indicator score on the y-axis there. And there's obviously some ups and some downs, but on the whole, people are really not showing any clear improvements in their sleep during their inpatient rehabilitation. And on the right, we have cross-sectional data. So it's, each individual dot there is an individual person. But nonetheless, what this sort of shows us is, again, that there's no real clear indication that people who are later in the time after their stroke have better sleep than the people who are earlier on in their recovery journey. So this really gives us an indication that something is happening. It's not just about the early sort of stages of the brain injury, but something sort of more persistent is happening that means people maintain poor sleep for a longer period of time. So one of the things that we sort of started on this journey because of is that we are interested in how sleep might impact on rehabilitation outcomes, and particularly in our case, motor rehab, because I'm a motor neuroscientist, so that's what I was interested in. But we know that sleep is really, really important for how people consolidate what they learn. And so that includes motor learning, but also obviously includes lots of other types of learning that are important during rehab. And there had been some work done that sort of indicated that people who have better sleep continuity or an overall more time spent asleep during rehab, that they have higher levels of functional independence and sort of better changes during rehab than people that have less continuous sleep or less sleep overall. And so what we found was that a measure of sleep disruption from actigraphy called sleep fragmentation index sort of quite consistently correlated with people's recovery outcome during inpatient rehab. So on the left here, we have the Rivermead Mobility Index, which is one of the sort of fairly standard measures that gets used here. And after accounting for the sort of initial severity of their functional limitations, we found that the higher someone's sleep fragmentation was, the worse their outcomes at discharge from rehab after accounting for that initial severity. And similarly, we were interested in the rate of recovery, so the rate of change in functional independence over the course of that inpatient rehab. And again, we found that sleep fragmentation explained a small but statistically significant proportion of the variance of change in recovery. So again, this suggests that people who have more disrupted sleep during their rehab seem to just recover a bit more slowly and don't get to the same end point as those who have more continuous sleep patterns. So that's kind of the background leading up to it. And we thought, well, that's all well and good, but what can we do about it? And so we decided that the first thing we would look at was using digital cognitive behavioral therapy for insomnia, or CBT. The reason that we chose CBT is that as I said, we were quite interested in insomnia symptoms. And we know that CBT is the guideline recommended first treatment for insomnia symptoms. Here in the UK, also in the EU, also in the US. So sort of quite broadly speaking, this is what people should be receiving before you go down the sort of track of looking at medications for insomnia. And we were interested in a digital technology because there are mega waiting lists to get in-person CBT, and having to go to an in-person appointment just isn't necessarily that suitable for someone who has had a stroke. And so this offers an opportunity to deliver this treatment at a much larger scale and from the comfort of people's own homes. The app had also been shown to be effective at improving insomnia in other conditions, but when we started, had never been tried in people who had had a stroke. So the first thing that we really wanted to do was to find out whether they could use it, and whether it was, potentially appropriate for somebody who had had a stroke. And we did this starting off with a qualitative study where we gave a cohort of, I think it was 11 chronic stroke survivors. We gave them access to the program, and then we interviewed them afterwards to understand what they thought about it and what their experiences were. I'm just going to sort of highlight some of these. So we had some really positive experiences of people that found that once they'd had a good night's sleep, they were feeling much more motivated, and that people generally liked the informative nature of the program. They thought it had good ideas, and this included some carers or partners as well as the stroke survivors themselves. But of course, not everything can be positive. So there were some sort of limitations identified as well by some of the people in the study. One of the sort of really key elements of insomnia treatment is about breaking this association between bed being a place where you're restless and unable to sleep. And so one of the suggestions that's made as part of the program is to get up and go and do something else if you're unable to sleep. And so people felt that having had a stroke and maybe having mobility problems, that might just not be ideal for them to get up out of bed. And similarly, we had some people who really just were not that keen on technology, and just didn't feel that they really had the skills that they used to have to be able to use the computer. But on the whole, when we sort of brought all of the comments together, we felt that if we provided a little bit of extra information to people, digital CBT for insomnia could be feasibly used by many community dwelling stroke survivors. Probably not all, but many of them we thought could give it a good go. So then we started our Inspire study, and we were really fortunate to be able to publish this in the Journal of Sleep Research in 2023, I think it was. So the primary aim of this study was to see whether this digital CBT for insomnia program would be effective at improving symptoms of insomnia for people who had had a stroke. So chronic stroke survivors living in the community at least 6 months after they'd had their stroke. So to do this, we first of all did a whole lot of baseline questionnaires with people. We did a lot of them online, some things were posted, and that meant that we could recruit people from all over the country. They didn't need to come into the hospital to see us, which conveniently worked out really well because we started about 2 weeks before the COVID pandemic. So fortunately, we were able to do everything online as it was. So we had lots of questionnaires. Our primary questionnaire was the sleep condition indicator, but we were also interested in other sort of comorbid symptoms or impact of the stroke as well. And we also posted people one of these actigraphy monitors to wear so that we could have a bit of a look at their sleep disruption as well. So we did all of that at baseline and then randomized people to either the control group or to the digital CBT group. The control group were given a sleep hygiene brochure, so it's sort of fairly accessible information that you could find on the internet, but it gives you sort of lifestyle and environmental factors, suggestions for how you could improve those. So things like making your bedroom dark and the right temperature and avoiding caffeine right before you go to sleep and those sorts of things. And then the digital CBT group got access to this CBT program called Sleepio, which it sort of mirrors an in-person approach, but it's all done automated online. So it has 6 weekly CBT sessions with this virtual animated professor, and a daily online sleep diary so that people can kind of keep track of how their sleep is changing. Now, it is supposed to be 6 weeks long, but the user can control how quickly they do it. And many people took quite a lot longer than 6 weeks to do it. And we let them sort of finish the program before we then reassessed them, because we wanted to have them to have the best chance that they could to get all the way through the program. So then at the end of that, we reassessed them with all of the same questionnaires and actigraphy. And then we left them just to get back to their normal lives for 2 months. And then we reassessed them again at an 8-week follow-up. And that was just because we wanted to be able to see whether any initial changes would persist, even when people stopped engaging with the program. So our primary outcome was the sleep condition indicator score at post-intervention. So that initial time point after they'd finished, which we assessed using an intention to treat protocol. So what we found was that after adjusting for the initial score at baseline, we found that there was significantly higher score for the digital CBT group in comparison to the control group. So this gives us an indication that there is fewer symptoms of insomnia or overall better self-reported sleep for the group who had access to the digital CBT. We also did a per protocol analysis, so just complete cases, people who had managed to get all the way through the program. And what we found, again, was that there was a significant improvement for the CBT group in comparison to the control group, and that these changes seem to persist, at least to some extent, at the 8-week follow-up. We also had a whole host of secondary outcomes. I'm not going to go through them all because we could be here all day, but they are in the paper. But we were interested, obviously, in whether their sleep disruption could be impacted by this CBT program. And we found no sort of clear and no statistical improvement with the digital CBT group for sleep fragmentation or wake after sleep onset. So we see some, fairly clear self-reported changes, but it's not as obvious when we look at objective measures of sleep disruption. We did find, we were also interested in how their mood would change, because we know that sleep disruption or sleep problems and mood, depression and anxiety are really comorbid in a lot of people. And so we found significant improvements in the patient health questionnaire, which is a measure of depression, and also the generalized anxiety disorder questionnaire, being a measure of anxiety. And again, these changes persisted, at least to some extent, 2 months later when we reassessed people. And then one of the other measures we were interested in was people's self-efficacy or self-confidence. And we found a non-significant tendency for an improvement in self-efficacy for digital CBT in comparison with control. It was sort of borderline significant, so we have to take that with a bit of a grain of salt. But that sort of potentially is something that's interesting that we should be exploring in the future. So that's kind of a whistle-stop tour through our rationale and through the paper. Just to sort of summarize that, I hope I've convinced you that sleep disruption is very common after brain injury and negatively associated with motor outcomes and recovery. And that digital CBT for insomnia seems to be a sort of viable option. So it's usable by many people living in the community after a stroke. And there are preliminary indications of effectiveness for this population. There's obviously still a long way that we've got to go. So what we're doing now is looking at whether improvements in sleep can lead to improvements in learning and rehab. So we're doing that by, again, looking at CBT, but looking at a specific motor learning task before and after people have access to the program. We're also really interested in understanding who responds and who doesn't respond to this. Because although at a group level, obviously we have an improvement, there are some people who had really significant benefit, and some people who didn't improve quite so much. And so we'd like to understand a bit better whether there might be any particular factors that could underlie that. We're also interested in treating a sort of broader range of sleep problems in people with stroke, because insomnia is obviously a key one, but it's not the only sleep problem that people have. And so over the next few years, we're going to be looking at sort of co-developing or co-adapting some transdiagnostic approaches that can tackle different aspects of sleep problems, all as part of one behavioural treatment regime.